I recently made a modular approach to survival and EDC video, and I presented these four modules. Small survival kit, this is a Maxpedition mini pouch. Toolkit and a Leatherman tool pouch. First aid kit in this first aid pouch I found on Amazon, and urban survival in this other pouch I found on Amazon. The sort of original kits that made this up were these two, and I added these two. I actually created these the day that I made that video. This sort of became my original standard. This is sort of how I defined pocket size, right? The idea was this kit in this Maxpedition mini pouch, which is like 4 by 6, I think, by 2 to 3 inches thick, depending on how stuffed you make it. This will fit in the pocket of my cargo shorts that I wear a lot of times in the summer, or in a cargo pocket of cargo pants, or a jacket pocket in the winter, or if I'm going to take photographs and I have a camera bag or a backpack, it'll drop in there easily. This is a little bit smaller. This is actually my favorite tool pouch, tool set, because this can go on your belt and it opens from the top so you can get to all this stuff while it's on your belt. And so this was kind of my standard, was like make kits this size. And I made this first aid kit, same size. This urban kit is actually a little too big. I'm still looking at options for this. And I've changed what's in this a little bit. So I'll make a separate video on this at some point. This is, I made, these two I covered in that other video, but I've worked on them since then, and this I've changed, and that's what I'm going to go over today, or in this video. So I'm going to put these out to the side here and focus on this. So this pouch, it's the right size. It's obviously first aid because it's red and it says first aid on it. So I like that. It's not the beefiest build, but it's not bad. It's an okay zipper. It's not a great zipper. I do like that it has the two pulls. And this is a phenomenally capable kit. I'm going to take everything out of this. I'll put it all out here, and then I'm going to talk it through. This kind of addresses sort of two different ends of the spectrum in terms of first aid requirements. And so when you look at first aid, in my view, there's sort of three tiers to it. One is the little cuts and scrapes you're going to get on an almost daily basis. And you want to be able to deal with those because they happen so frequently. On the other end of the spectrum is the major traumatic injury that's life-threatening. And you want to be able to handle that because it's life-threatening. Then in the middle, there's a whole middle ground, and you can make a gigantic first aid kit covering all the things that come up there. What this kit does is it covers the trauma on one end, and it covers the minor cuts and scrapes on the other end. So what you have here is this vinyl pouch. This has Band-Aids, a little bit of moleskin in case you get a blister. It's got some antibiotic ointment. It's got povidone iodine pads to clean a wound. It's got a little bit of burn gel in here. I guess I'll open this up, take this stuff out. So you've got some Band-Aids. These are Bayerdorf Band-Aids, which are really nice Band-Aids. It's got a little bit of burn gel. This is a little burn pad, blister pad, Spenco second skin kind of thing. A little bit of moleskin. You just cut this and put it over the blister. It's got a small pair of tweezers, Uncle Bill tweezers. I will link to everything below. They're not affiliate links. They're just for your convenience. Povidone iodine pads for cleaning the wound, and some antibiotic ointment. So that's your, boo-boo kit, right? Minor cuts and scrapes. It also has this med pack. And this is, in my opinion, sort of the critical meds you really want to have with you. Okay, first of all, these are 4 chewable 81 milligram baby aspirin. I don't know why nobody makes a pack of this, because this is a really critical thing to have with you. If someone is having a heart attack, check with them, make sure they're not allergic to aspirin, right? You don't want them to have an anaphylactic reaction to aspirin on top of having a heart attack. But if they're not, then you have them chew this, and it has a really big impact on the outcome. How well they recover, how likely they are to recover from the heart attack. By chewing the baby aspirin, it helps, this helps thin the blood, it helps prevent damage from the heart attack, and it makes their outcome much better. Got some Benadryl in here. This is sort of the most powerful allergy medicine you can get over the counter. If someone's having a really severe allergic reaction, they might need an EpiPen if they're having an anaphylactic reaction. That's a prescription medication, and it's also big and not going to fit in a kit like this, but this is the best that you can do for them in that situation. Got some Imodium for diarrhea. Diarrhea can dehydrate you and actually be life-threatening, so this is a very important thing to carry as well. And then finally, and I want to be careful how I present this, you need to think about whether or not you are comfortable doing this. You need to talk to your doctor about this. But in some first aid, wilderness first aid books, they talk about if somebody is really badly injured, if you're in a situation where you need the maximum pain relief you can get without a prescription. We've got 2 packs of Advil here. There's 2 pills in each one. So there's 2 200 milligram Advil in each of these. So you take one of these packs, that's 400 milligrams of Advil. That is the over-the-counter dose. If you take all 4 of these Advil, that's 800 milligrams of Advil. That's a prescription dose of Advil. That's something doctors give to women for menstrual cramp problems pretty routinely. This is extra-strength Tylenol. Extra-strength Tylenol is metabolized in your liver. Advil is not metabolized in your liver. I forget exactly where it is metabolized, but it's a different action. You can take this all at once. Okay, again, you should talk to your doctor. You should make sure that that's okay, that you're comfortable doing it. But you can take all of this at one time and get the maximum pain relief possible. So if you've just broken your ankle or broken your arm and you're walking out of somewhere and you're in tremendous pain, this gives you an option for controlling that pain as much as possible. Now on this side we have the trauma kit. These are Rescue Essential gloves. Not super thick gloves, but this gives you some gloves to protect you. And it's a really small form factor, so that's really nice. Now, if you have really serious traumatic bleeding, one of the things that there's been a big focus on in recent years with all of the mass shootings and things like that is Stop the Bleed. There's something called stopthebleed.org. I really encourage you to go read about that effort and learn about stopping the bleed. If you have a very severe bleeding injury in an extremity, you use a tourniquet. Now, this is a SWAT T tourniquet. If you're just going to carry a tourniquet, the best tourniquet is the cat tourniquet. And the reason it's better than this is because you can put it on yourself. You can put this cat tourniquet on with one hand. This takes 2 hands. This is like an elastic kind of tourniquet. The reason this is in this kit instead of the cat tourniquet is because this is a multi-use product. You can take this, you can wrap someone's extremity with this. You wrap above where the injury is by a couple of inches. You wrap it really tight. It's got these kind of ovals that when you pull it tight enough, they're circles. You wrap this around and it's a tourniquet. If you wrap it looser, you can wrap it over gauze and make a pressure dressing. So you can do 2 different things with this, which you can't do with the cat tourniquet. So that's why this is in here. The form factor is good for this kind of kit. And we have 2 options here, gauze-wise. This is hemostatic gauze, which means the gauze actually reacts with blood to thicken the blood and stop bleeding. So if you have really, really serious bleeding, you can take this, you can pack the wound, you can wrap the wound, You can put that over it and create a pressure dressing. This is just compressed gauze. This is regular gauze. Again, you can pack a wound with this and wrap that over it. So really serious wound on an extremity, if it's, like arterial bleeding or somebody's really bleeding to death quickly, you can use this as a tourniquet. If the bleeding is less severe, you can use this with this over it as a pressure dressing, or this with this over it as a pressure dressing. If someone has a junctional injury, okay, where your arm meets your body, you have your armpit, that's a junction. Where your legs meet your body, your groin is a junction. If someone has got a junctional injury, you pack it. You can, if it's really severe, you can pack it with the hemostatic gauze. If it's not really severe, you can pack it with the compressed gauze. The other thing, this is one of the most versatile first aid items you can carry. And so with this setup, you can use this on the most severe injury, possibly with this to create a pressure dressing. And then a slightly less severe injury, you can wrap with this, or you can pack with this. So if you've got a junctional injury, you can pack it with either one of these. If it's an injury on the torso or something like that, you can wrap this around it. You could take either one of these with this and make a pressure dressing on the torso. If someone has a puncture wound in their chest and it is bubbling, gurgling, this is a chest seal. This has a one-way valve in it. Your lungs basically inflate because your chest is rigid, your rib cage is rigid, your chest cavity is sealed, and your body actually creates a vacuum between the sacs of your lungs and the rib cage, and your lungs then expand to fill that vacuum area, and that's what inflates your lungs. And so if you puncture a hole through into somebody's chest cavity and air gets in, their lungs will not inflate. You put this over the opening. It's got a one-way valve. It lets the air out, and it can reinflate their lung. Now, ideally, you're going to carry two of these, because if somebody has been shot, they might have an entry wound and an exit wound. There really isn't room in this kit for it, so I only have one. If there's only an entry wound, you put this on and you're good. If there's an entry and an exit wound, take one of these plastic bags or take one of these gloves and put it over the exit wound. Stuff it, in the exit wound. Put it over the exit wound and wrap it with this. So this goes on the entry wound, this goes on the exit wound. You've covered both of them, and this lets the lung reinflate. So in this very small kit, you can handle very severe traumatic injuries. You can handle all the minor cuts and scrapes. You don't have the middle ground stuff. Like you don't have a elastic ace bandage. You don't have a thermometer. You don't have, all of those kinds of things for, lots of gauze pads for different sort of minor injuries and things like that that are a little bit bigger than this covers. But this covers the life-threatening, really serious traumatic stuff, the day-to-day stuff. So it's a very, very capable kit in a very small size. If you like this video, please like and subscribe. I'm doing a lot of this kind of content right now, and that way you'll be sure and see it. Again, there's links to everything below, so you can put one of these kits together for yourself if you want to. They're not affiliate links. Thank you for your attention.